Joining us now to discuss this a bit more further, we are joined by Professor Renata Schoeman. She is the Head of Healthcare Leadership at the Stellenbosch Business School, and she joins us via our video link. Professor, thank you so much for joining us here on the late edition. Of course, we are told that South Africa loses at least 160 billion rand per year due to mental health. If you can just paint a picture for us, clearly we have a major problem in the country when it comes to mental health.
Yes, Mbali, mental health difficulties has absolutely been on the rise, especially over the past couple of years, triggered by the COVID pandemic and the impact it had on personal lives and livelihood. But also together with that, the other socioeconomic difficulties that we are facing, unemployment, inequality, energy difficulties in the country, etc. And even if we then compare with other countries in similar situations, South Africa is really not doing well. Now, part of this is due to stigma, where people do not seek support when they do have mental health difficulties, but often they're unaware that what they experience is a treatable condition. That is further amplified by the government lack of really funding mental health. We really only get about 5% of the healthcare budget. But furthermore, organizations are also not joining the party and really living up to what they should be doing for their employees.
And Professor, you've attributed this mainly to what we experienced during COVID-19. What are the other contributing factors? Surely there's more, because even pre-COVID-19, South Africans were already highlighting problems of mental health, especially in the corporate sector.
Absolutely. So in the organizational space, there's different things that plays a role. Obviously, there's the personal and the bigger systemic issues that we've touched on. But then there's also the difficulties that we have with the hybrid work model. So during COVID, the spotlight was on mental health conditions, and many organizations did very, very well in supporting their employees. But very few of them managed to sustain this effort and to really build it into their day-to-day practices and also make it part of attraction and retention programs. And we know that if you invest in a happy, healthy workforce, they are more productive, they're more creative, there's better office dynamics. But now we have people that work in flexi-time and in flexi-space environments, which then actually ends up not having the best of both, but the worst of both worlds. They struggle with the pressures of commuting to get to the office in time, traveling costs, also office dynamics and politics that they can have. But then also when they work from home, there's the lack of the boundaries and difficulty having work-life balance, especially if they struggle to switch off from technology, if the organization's policies do not support this structured working time. And then also if you work from home, you're even more prone to becoming socially isolated, problems are not identified, and people do not have access to the EAP programs, which is mostly targeted to the workforce that's at work. And this is maybe where the transition was also very difficult and where people really do not get the support that they need.
And coming back to the actual number of how much it's actually costing, big companies in South Africa, how are we able to actually quantify this to show how much it's costing the economy?
Well, there's a number of studies where they looked at in terms of stress-related disorders in South Africa and what is the cost per capita. And all the studies dating back to 2012 worked out about 54,700 rand per person that it went untreated in terms of mental health disorders. But this most recent study looked at the employed workforce and stress-related conditions. And what is interesting that although people often think absenteeism is the expensive thing, when people aren't at work, when they may be admitted for a mental health condition, presenteeism is way more expensive. So as you mentioned, presenteeism being people that's ill at work and not necessarily getting the necessary treatment. And what we also see is that it has what we call a bimodal distribution. So it's primarily people that's either in the lower levels of employment, wage earners, no work, no pay, and then also at the top structure of executives, which feel that they always need to be strong, they cannot admit to having mental health difficulties, they cannot afford to be absent from work, who will take the decisions, but they can make very costly decisions. And that is costing the South African economy actually more than the whole of the tourism industry and more than the total value of social grants in South Africa.
And Professor, a number of workers often complain and say that, when you speak of mental health problems, it's something that people are still a bit embarrassed to even talk about. What needs to be done by companies to ensure that, workers actually overcome this problem, especially in the workplace, because clearly it has serious ramifications for businesses?
So the very first thing is to move from a reactive position to a preventative position. Many of the EAP programs only focus on identifying when the problem is there, we kick in. But a preventative approach is way more effective. And preventative measures is about education. People need to know what is mental health disorders and that it's treatable conditions. Secondly, stigma need to be addressed. And part of the first steps of stigma is when leaders come to the fore and say, I also don't cope all the time. Sometimes I struggle with anxiety or depression, or I might have received treatment. When leaders are able to be more authentic and disclose their difficulties, often employees come to the fore. And also these more authentic leaders also understand more what is the emotions and the difficulties and the lack of support people might be going through. So when you are at that stage, that is where you can have proactive, preventative, holistic approaches to mental well-being in the workplace.
And would you say that companies are now willing, to come to the fore and to understand and actually take this matter seriously, since seeing it's costing them so much money?
I think that's the one, I want to say, blessing in disguise from lockdown, where it really, many companies stepped up their approaches and realized how important it is to take care of the employees' well-being, because mental health was, in the end, mental wealth and organizational wealth, which contribute to the economy. Many companies were able to sustain their efforts. It's only now with a hybrid workforce that we struggle a bit more again. But then many companies, unfortunately, the efforts has dwindled despite problems still being on the rise. So we're not doing enough, but there are organizations that I want to thank for their efforts as well.
All right, Professor Renata, thank you so much for your time. That is Professor Renata Schoeman from the Stellenbosch Business School, and she is the head of healthcare leadership.